Hello everyone, and thank you for attending my research proposal on does vitamin D supplementation improve chronic kidney disease stages in African American men and women. My name is Jessica Crone, and I am earning a Master of Science in Applied Nutrition at the University of New England with an expected graduation date of 2020. I am excited to present this proposal as previous research suggests that maintaining optimal levels of 25-hydroxyvitamin D with vitamin D supplementation may decrease one's CKD's development and progression. I would like to disclose that there were no conflicts associated with this research proposal. Before we start, I would like to share my professional background. I attended Francis Marion University from 2006 to 2010, where I received a Bachelor of Art. As I stated earlier, I am pursuing my master's degree in applied nutrition. I am currently working as an assistant supervisor at Palmetto Citizens Federal Credit Union. I've been there almost 10 years, and at my previous job, I was a customer service representative / floor supervisor, which was at Kroger. I am looking to utilize both my education and professional experiences to work in the health promotion field. I would like to help individuals learn to budget and shop healthy, and even create educational handouts with my graphic design degree. Chronic kidney disease and vitamin D deficiency are growing health issues among minority men and women living in the United States. Research shows that individuals of African American, Hispanic, Native American, Asian, and Pacific Islander descent are at an increased risk of developing CKD. Depicted in the graph on the slide, researchers Melamed et al. Tested the hypothesis that low 25-OHD levels are associated with CKD progression, using data from the National Haynes third follow-up study. If low levels of 25-OHD are a risk factor for CKD progression, it will help explain some of the additional risk for end-stage renal disease in non-Hispanic Black and Hispanic individuals. Additionally, African Americans also have higher rates of diabetes and high blood pressure. These factors put them at an even higher risk for developing CKD. Diabetes is the leading cause for kidney disease. It is estimated that about 1 in 4 adults with CKD also have diabetes. Individuals diagnosed with diabetes and hypertension should be tested regularly for CKD to detect it early. Also, individuals can lower their CKD risk by managing their blood sugar and blood pressure while making healthy lifestyle changes. However, lack of awareness of CKD and its complications keep many individuals from having more positive health outcomes. If CKD is left untreated or undiagnosed, individuals will have complications that could lead to hospitalizations, additional treatments related to CKD, or other comorbidities, and even death. To decrease the prevalence of CKD, the CDC has implemented an initiative that collaborates with government agencies, universities, and national organizations to aid in preventing and managing risk factors for CKD, raising awareness of the disease, promoting diagnosis and management of CKD, and lastly, improving outcomes for people living with the disease. Evidence also suggests an association between low levels of vitamin D and the risk for diabetes. Healthcare providers need to be able to recognize the signs and symptoms of vitamin D deficiency and treatment options to assist individuals in having better health outcomes. With my research proposal, continued research can aid in assessing any differential effects of vitamin D supplementation in populations such as African Americans that are high risk for CKD. Also, while vitamin D is typically associated with bone health, vitamin D deficiency has recently been found to be highly prevalent in CKD patients. Optimal levels are considered to be at 30 ng/ml. Consuming adequate vitamins and minerals is crucial for the medical nutrition therapy of CKD patients. Therefore, the use of vitamin D supplementation could prove to be an easy and inexpensive method to increase vitamin D levels in CKD patients. While CKD impacts about 37 million United States adults, it is more prevalent in African Americans and people over 65 years old, as you can see in the graph from the CDC. Therefore, the purpose of this study is to examine the impact of vitamin D supplementation in African American adults with CKD to determine if their estimated glomerular filtration rate would be improved once their vitamin D status is back to optimal levels. For this study, the recruitment of the participants will include recently admitted African American men and women from 10 various nephrology clinics across the United States. To be eligible to participate in the study, the subjects must be at least 18 years or older and meet additional inclusion criteria. The requirements include African American men and women. The subjects must be between 18 and 70 years old, have a vitamin D deficiency with their serum 25-OHD levels being less than or equal to 20 ngl/ml, and their eGFR status should be between 60 and below 15. Participants will be screened to see if they meet the appropriate criteria to be considered for the study. Each participant will have their lab values taken before the study for their serum vitamin D levels and eGFR to determine their kidney stage. The research study will be an experimental study using a random control trial. There will be two groups randomly selected with 35 participants each. The experimental group will receive vitamin D supplementation of 50,000 IU every week for 12 weeks, and the control group will receive a placebo. Participants will be required to come to the office for a weekly check-in with their physicians and receive their weekly supplement of vitamin D or placebo to ensure that participants are compliant with their supplementation intake. After the sample size of at least 70 participants have been reached, the study can begin and the researchers can start collecting the data from the participants. The results of the study will use an independent t-test, which will indicate if there is a significant difference between the two means of the group. All the data will be recorded pre- and post-intervention treatment. Vitamin D levels will be evaluated after 12 weeks, and the eGFR will be assessed at a 6-month follow-up. The data gathered from the study will be used to find new cost-efficient and safer ways to treat and manage various stages of CKD, as Medicare reported that treating beneficiaries with CKD in 2017 cost over $84 billion. This information will benefit both the research team and the clinic staff to see if any improvements can be developed to the nephrology clinics, not only in the U.S., but also across the globe. With the expected results showing a statistical significance of reversed eGFR and higher vitamin D levels, new treatment plans can be developed to help decrease CKD prevalence. As CKD and vitamin D deficiency continue to rise, it will remain important to continue investigating the relationships between these health conditions, as each one can adversely impact the other. Findings from this proposal suggest that low levels of 25-OHD may be linked to CKD progression and other risk factors associated with CKD in African Americans. Potentially increasing vitamin D levels may aid in reversing or slowing CKD progression and assist in decreasing additional symptoms. Helping correct vitamin D levels could potentially lead to eliminating and preventing other illnesses individuals with CKD may develop. In conclusion, I would like to disclose that my research proposal did not receive any financial support or grants. At this time, I will open the floor to any questions that anyone might have. On these final slides, a list of the references used in the proposal will be provided. Thank you again for attending my research proposal, and have a great day.